Hi, I'm Monica Wakefield, and I'm here interviewing Darlene and Marvell. Darlene is a licensed practical nurse, and Marvell is a registered nurse, and I'm interviewing them because they are in a medical field that I intend to pursue. So, for Darlene, what led to your interest in nursing?
My first job was a nursing assistant, and then from that job I was inspired to go to another level of patient care. So I went into the licensed practical nurse.
And Marvell?
I was led by family members that was in the medical field, and then working with quite a few of them in the hospital. I went from a nursing assistant to a clerk, and then right on to a registered nurse.
Okay, so becoming LPN is what you would call a licensed practical nurse, and RN for a registered nurse. What college education did both of them need?
Okay, for the LPN, it's right at a year of education at I did it at Florida Community College with hospital training, hands-on training, classroom training, testing, and now I'm in that field and have been a licensed practical nurse for 3 years.
And for Marvell?
I went into the prerequisites, a lot of the science and the math classes at Coastal Community College in Brunswick, and from there I pursued my nursing career on into Jacksonville at FCCJ, and went right into the field of nursing. I've been since the year 2000.
So which class, or both, would you consider to be the most difficult, and which one was the easiest?
I did not really have a challenge with the classroom or theory, or even the hands-on. It was the NCLEX, passing the boards was a little bit of a challenge, but I was successful the first time around.
I would have to say also, the NCLEX was a challenge. It's a lot of study in there.
Okay. And once you did pass the board and you got registered or your license, what did you expect for the LPN when it came to training or the work experience, and then the RN for training and work experience?
My expectations, as I did hands-on, was for for the field to broaden spectrum for me to learn more by doing hands-on the patient care, and it is up under the instructions of an RN and doctors.
Okay, and what kind of training did you receive when you first came out to enter the field, and what was your work experience like?
My work experience was very, very nice. It was a lot of hands-on, as Darlene was saying. I worked in the maternity area for mother-baby. So we worked with the infants as well as the mother. We was able to go straight right into working in labor and delivery, to catching the babies to C-sections, doing outbar scores, and moving right on to work with the mothers.
And did both of you all start off in the hospital, or was it more of an office setting?
Initially was hospital, but then I went into long-term care, most of geriatrics, rehabilitation. From there I moved to home care.
Okay. And which hospital did you first start at?
Shands.
And you started at which hospital?
St. Vincent's. I started when I was 17 and a half. We were trained by nuns first. We had work as a nursing assistant. You got on-the-job training within 3 days, and then you took exams and you were able to pass. Nowadays, you can't do that. You have to go to FCCJ or some other college. Right then, they had a school of nursing at St. Vincent's.
Okay. And for the LPN, when you did start off, what position or what rates were you getting, and what would you say differs from probably what an RN receives?
Well, the rates varied in the different facilities that you worked. I guess I'd have to say I stayed into long-term care rehab a very short while after I found out about the advantage of working into home care. The rate is much better there. If I have to say a minimum and a max, minimum of 24, max of 37 per hour in income.
And for the RN, to start off, probably, which ones would be better for if it was a hospital or outside?
I would say probably the hospital, but it has to be like in the intensive care area, a more
Specialized, right?
yeah, more specialty area than just, you know, in the basic unit. I started off with, like I said, maternity, then I branched over to neonatals at Shands. That was challenging, yes, the pay is a bit more there.
Okay, and let's see, what made you stop at just the LPN, or what made you stop at RN, or did you ever consider pursuing being a doctor?
Well, no, not at that level. And just to say to stop at the LPN, I don't know that I've completely stopped, but right now that's where I am.
For RN?
That would be basically the same for me right now because I am enjoying what I'm doing right now. I haven't decided to really, you know, broaden it a little bit more just yet.
What if you had to give someone like myself or anyone else who wanted to do, whether it was a certified nursing assistant or LPN or RN, what advice would you give them as far as going to school, which places they should inquire to work, and which ones are better, or any advice that you wish you had that nobody gave you before you started?
My advice would be to focus, focus on your patient, focus on the rules, regs, and policies of the facility, and also you have to have a compassion for the well-being of people to be in this field. So it's something that I really enjoy doing. So I would say stay focused on those few things.
Okay, and you?
I would say just about the same thing. You really, really have to care. Because if you don't care, then, I mean, your heart's not in it. Why even go to that field? You really have to care. Your bedside manner means a lot to a person that's sick, whatever. So I would definitely say just really focus and be caring.
Okay, and when it comes down to more so of actually working, what would you consider for LPN and RN to be the role of communication?
The role of communication is patient education, communication with peers, communication with the doctors, different levels of management, other disciplines in the medical field.
Okay, and RN?
It would be about, basically about the same. The patient as well as the caregivers that are with the patient, being that we're caregivers, but as well as the doctors, the relatives, because you might get patients sometimes that might not understand things that might not go as smooth. You still have to talk to the family members and just communicating overall.
Okay, and do you see yourself working in this field for the next few years, or do you think of changing it anytime soon?
Maybe changing. I think where the economy is right now, this particular area, it's okay. I won't say it's safe, but it's okay based on the economy. So I think I will be in the medical field for a while, but at this level, I don't know right now.
Okay, and do you have any input on that?
I think it would be a safe unit to still stay in because like there's so many hospitals and so many businesses that are closing, but yet still home health care and visiting nurses and visiting physicians are getting broader and broader.
You've spoken about what led you into the field of nursing and what is required to become a nurse, whether it's LPN or RN. I kind of want to get more into detail of what you actually do and what profession, as in your job that you currently hold right now, and what is required. So for right now, you are employed at Apex Home Health, I believe, and they have, I think, 2 different offices, and you are required to do what as of now, or have you changed positions or anything?
Okay, I've been at Apex now for 2 years, and initially I was required to do home visits to the geriatric population. That was with medication management, wound care, patient teaching, and managing the patient at a level to where they would be at home and trying to keep them out of the hospitals as much as possible. So this agency brings the health care into the home. So in managing the patient, those are some of the things that I did initially. Along with the med management, we were required to do documentation, write physician orders, follow all of the physician orders. And currently I'm doing cardiac monitoring. That is something that I have advanced to with installing the telemonitoring equipment, monitoring our cardiac patients, triaging our cardiac patients. And basically that's what I'm doing right now with Apex Home Care.
So, since you had the advantage to try home health and the hospital, which one do you think is a little bit more difficult for as far as working, or which one do you enjoy more?
Well, it's a little bit more of a challenge to work at the hospital because you're confined. You're there for long hours, 12 hours. It could become just a little bit tiresome. Right now, for where I am in the home care, I like that better because it offers a lot of flexibility. It offers a lot for learning. It offers a lot for individualizing the patient's care. It's a better field for me to be in the medical field in the home care versus in the hospital. But I will go back to the hospital if I'm needed to go there or if I have to go.
Okay, and exactly why would you say that it's more as far as home health? Why is that better or an advantage with you compared to the hospital?
Well, my lifestyle, it offers me, like I said, a little bit more flexibility. You don't have a set time. You set your own schedule. You schedule the time that you're going to see your patients. You do collaborate with your patient to make sure that that time is convenient. But there is no set time. It's not a regular 8 to 5. It's not a regular 12 hours. Normally what someone does in 8 hours in home care, I can do in 6 hours. I can do more in the 8 hours. Of course, that is going to increase your pay. I can choose to set my schedule up to see as many as 4 or 5 a day, as many as 7, 8 a day. I can have a short day or a long day, but I am required to meet a quota of seeing patients, but the flexibility is up to me. So it kind of creates for me an environment that is flexible for my lifestyle. It's good for me.
And also a question that I hear a lot with any type of medical field, it's with, now that I am trying to pursue it and taking classes, I'm hearing a lot that whether it's a CNA, LPN, or RN, depending on the AAAS or having a bachelor's or master's, some of the pay can level out to where sometimes LPN may make the same as an RN, or actually, I believe at Baptist, I heard from someone at FSCJ that an AA and an RN is a $1 difference. So being in home health, do you know anything about that, or is any of your pay kind of leveled out with someone else who may have a different degree?
Well, yeah, I found out that in the home health, the pay rate is better in home health for LPN, RN, or any of the medical disciplines, as opposed to in the hospital. Although there are nurses or medical professionals in the hospital that make a little bit more, that's based on the number of years that they've been there. But for initially starting out, I would say that home health care was more of an advantage for me financially, as opposed to being in a closed-in facility at the hospital.
So some of it might have leveled out outside of the hospital range compared to...
Yes. Now there are some, from what I've learned, with some of the RN starting paying me as an LPN, I'm already there, and some have exceeded. But it's just based on the different fields for the medical professional medical profession that you're in.
Okay, and you did mention that you probably would try to pursue the nursing for a couple more years, or maybe even look into getting an RN, but you spoke about what you would encourage someone to do, or what you may have wished someone encouraged you to do when you entered the field. So are there any last words that you could think of to add in, or any stories that stick with you?
Well, to encourage you, Monica, if you're not sure about the medical field, I would say start from the LPN level. That way you won't be as in-depth and put so much time into it to find out that you don't like it. So there's an advantage to being an LPN, because it is less as far as the education, but if it's something that you think that you're going to have a passion for, I would say yes, pursue your RN. Pursue your RN. I would say go as high as you could go. Be, as they say, be all that you can be in the medical field. But there again, as an LPN or RN, there's always administrative work that you can do. But I would think that anybody coming into the medical profession at one time or another, I think it is needed for you to have hands-on learning about the different disciplines, the whole, what the medical field entails, what it, the experience of hands-on medications, to see how all of it ties in. But there's the avenue for the medical profession is very broad. So again, I would say pursue it. Be all that you can be in this particular field, particularly if you find that you're going to like it. And I think that you will enjoy it. But you got to be focused.
Okay. Well, thank you for your time, and I appreciate all the information that you have given me, and I will use it to the best of my advantage when hopefully I do enter the nursing. I believe by the end of this, no. Actually, hopefully I should enter the nursing field this upcoming spring or for the summer term. So I appreciate it, and thank you.
You're welcome, Monica.